Paediatric First Aid Level 3, Unit 2. You need to successfully complete both of the units in order to achieve the full Level 3 qualification. However, you must have completed Unit 1 before starting Unit 2. Certification is valid for a 3-year period. And requalification is to attend and successfully complete this same course. So we're going to be looking at the managing of paediatric illnesses and injury, bones, joints, muscle injuries, head, spinal injuries, foreign body and eye injuries, chronic medical conditions, effects of heat and cold, electric shock incidents, burns and scalds, poisoning, and bites and stings. Bones, joints and muscle injuries. The skeleton supports the muscles, blood vessels and nerves of the body and protects the organs. The joint is where one bone meets another. The muscles allow various parts of the body to move. Ligaments hold the movable joints together and tendons hold the muscle to the bone. Fractures. A closed fracture, the broken bone does not penetrate the skin. An open fracture, the broken bone punctures the skin, and a complicated fracture involves an injury to another part of the body, for example a fractured rib and a punctured lung. Recognition of a closed fracture, there will be pain, swelling, deformity, internal bleeding leading to bruising, and shock. Treatments, we support the injured parts, leave the casualty in the position found unless they can move the injured part to a more comfortable position. We treat for shock and we call for an ambulance. Recognition of an open fracture, there will be pain, deformity, internal and external bleeding and shock, and a very high risk of infection. So treatment for an open fracture, we treat as any other fracture. Control any bleeding, make sure you wear gloves. Apply sterile dressing around the wound. Do not apply any direct pressure on the wound. We support the wound in a position found, treat for shock, call for an ambulance. Complicated fractures. The recognition, there will be pain, deformity, internal and external bleeding and shock. We treat for any other closed or open fracture. Check the casualty for any further injury or complications such as a fractured rib penetrating the lung and treat accordingly. Dislocations. Pain, swelling, deformity, and the inability to move the affected area. Where you have a joint where one bone meets another, you can dislocate it. The treatment, treat as a fracture by supporting and immobilizing in the position found. Do not attempt to put the joint back in place and transfer to hospital as soon as possible. And always treat for shock. A child with a dislocated shoulder, for example, may start to vomit as an indicator of shock. Soft tissue injuries. These are injuries to the muscle, ligaments and tendons, often sport related. Sprain, for example, this is an injury to the ligaments surrounding a joint, possibly caused by overstretching or a sudden twisting movement. Whereas a strain, this is a tearing injury to the muscles and tendons, possibly caused by overstretching or too heavy a workload placed on the muscles and tendons. The recognition of soft tissue injury for both strains and sprains, pain, swelling, bruising, inflammation if you touch the injured area is hot to touch, cramp. Treatment in all cases. Remember RICE. Rest the injured parts, ice, apply a cold compress, comfortably compress the injury for about 20 minutes while waiting for an ambulance to arrive, and where possible, elevate the injured part. Recognition of concussion. There could be a brief loss of consciousness, dizziness, a mild headache. The child complains of disturbed vision. If you look at the centers of the eyes, the pupils, they are equal. Loss of memory. This is usually short-term memory loss. They remember banging their head, but they can't remember what they were doing 5 minutes ago. Pale, cold, clammy skin, nausea, typical indications of shock. The treatment of concussion: sit the conscious casualty down or lay them down with the head raised if they are unsteady. If they are unconscious and breathing normally, place them in a recovery position. Monitor airway, breathing and response levels. And if they are unconscious for any length of time, you call for an ambulance. Recognition of a cerebral compression. This is potentially a very dangerous injury, so there's evidence of head injury externally. The child may complain of intense headache, slow, noisy breathing, very slow and strong pulse. The pupils now are unequal. The one pupil is dilated or much larger than the other. There will be a high temperature, flushed appearance, drowsiness, maybe a change in personality, paralysis and weakness of the limbs. A skull fracture could lead to fluid escaping from the ears and nose. The treatment of cerebral compression: lay your casualty down, head and shoulders raised. You dial 999 or 112 for an ambulance. If they are unresponsive and breathing normally, leave them in the position found. Maintain their airways, could be damage to their neck. Monitor airway, breathing and response levels. And if conscious, do not give them anything to eat or drink. Recognition of a skull fracture: fluid coming from the ear or nose, evidence of head injury, unconsciousness, a wound, bruise or depression on the skull, a soft area or depression of the scalp, blood in the whites of the eyes, a distortion to the head and face. Also associated spinal injury. Treatments of a fractured skull: if you suspect spinal injury, do not move them. You call for an ambulance. Monitor airway, breathing and response levels. Cover the air with a sterile dressing. Cover it relatively loosely. Control any bleeding and fluid loss. And all head injuries must be advised to go to hospital. Now with children, they don't argue, they go, whereas an adult can always refuse. Fainting recognition: children are particularly susceptible to fainting. Fainting is due to a temporary lack of blood supply to the brain. Recovery is generally quick, and no harm will come to your casualty with some very simple, prompt treatment. They may feel nauseous, dizzy and weak. They'll have a pale complexion, possibly sweating. The pulse will be slower than normal. May go into unconsciousness briefly. Treatment for fainting: help them to the floor if possible, lay them on their back, raise the legs to a position above the heart and support. If it's warm, allow fresh air in and cool them down. Check the airway, ensure they're still breathing normally. Loosen any tight clothing and keep talking to them and reassure them throughout. If the spinal column is damaged, pain in the neck or back at the level of injury, a step or twist in the normal curve of the spine, and tenderness upon gently feeding the spine. If the spinal cord is also damaged, there could be loss of control of one or more of the limbs, abnormal sensations such as burning or tingling, disorientation or bewilderment, difficulty in breathing. Treatment in respect of any spinal injury will prevent any movement, maintain an open airway, and call for an ambulance. Foreign body and eye injuries. Your aim is to prevent any injury or infection to the eye, so you advise the casualty not to rub the eye. Wearing your gloves, you separate the eyelids with finger and thumb. If you can see a foreign object on the white of the eye, wash it out with clean water or sterile eye wash. Do not touch anything that's embedded in the eye, as you may scratch the surface. Cover the eye and send to hospital. Do not poke anything into the eye to remove the object, and only use sterile eye dressings to cover the eye. Chemical burns to the eye. Wash the chemical from the eye with fresh running water for a minimum 10 minutes. Do not let the chemical run into the other eye. Protect the casualty from any contamination when irrigating. Cover the eye with sterile dressing and send to hospital. Flash burns to the eye, caused by exposure to ultraviolet light. There will be redness and pain within the eye, a very dry, gritty feeling and excessive watering. Reassure the casualty, cover the eye with a sterile pad and send to hospital. Foreign objects in the nose, in the ear, swallowed or in the eye are always going to be problematic. Chronic medical conditions and illnesses. Diabetes, hypoglycemia or type 1 diabetes, hyperglycemia type 2. In children, type 1 diabetes is quite common. In fact, about 65% of children with diabetes will suffer from type 1 diabetes. Now, the onset is very quick. Vomiting is uncommon. Thirst is absent in hypoglycemia. Breath odour is quite normal. The skin will be pale, cold and sweaty. Seizures are quite common and consciousness will be lost rapidly. With hypoglycemia or type 2 diabetes, there's not enough insulin used. Deterioration is gradual, very gradual. Hunger is absent. Vomiting is common. Thirst will be present. Breath odour will be very fruity and sweet. Breathing rapid. Skin dry and warm. Seizures in this kind of diabetes are uncommon. Diabetes treatment for hypoglycemia of type 2 diabetes. If they're unresponsive, place them in a recovery position, call for an ambulance. Monitor breathing and response levels. A person with type 2 diabetes may tend to have a very aggressive body language and speech. Type 1 diabetes or hypoglycemia. Sit the casualty down, give them a sugary drink. If this is effective, give them more. Follow this with sweet food, biscuit, cake. Where possible, try to avoid chocolate. Monitor and reassure them. If this has no effect, call for an ambulance. And if they become unconscious, put them in a recovery position. Asthma recognition. Breathlessness and difficulty in speaking. Difficulty in breathing out, sometimes wheezing, coughing. Breathing may be slow and prolonged. Increased breathing effort. Possible blueness at the lips and other extremities. Casualty will become weaker as the attack becomes more acute. Treatment, help the casualty to a comfortable sitting position, calm, reassure them, encourage them to use their own prescribed medication. If their reliever medication has no effect, if the attack lasts for more than 5 minutes or it's their first attack, we call for an ambulance. If the casualty becomes unresponsive, you carry out your basic life support procedures. Meningitis. Symptoms could include severe headaches, fever or high temperature, stiffness in the neck, quite common, dislike to the light in the eyes, muscular pains, drowsiness, disorientation, seizures, and a skin rash that looks similar to small bruises that will not disappear if pressure is applied. We need to be careful because there are two main types of meningitis, bacterial and viral. The symptoms can be exactly the same. Please bear in mind that all these symptoms may not appear together. If you have any suspicions, get emergency medical care as soon as possible. Now, the main ages of exposure to meningitis, both the viral and bacterial, is newborn until the age of 1 and 15 to 18-year-olds. But one must remember that you can contract meningitis at any age. Febrile convulsions recognition. Some young children experience febrile convulsions, which is brought on by a high temperature or infection. Flashed, sweating, body may stiffen, the back may arch, fists may be clenched, may hold their breath and appear blue in colour. Febrile convulsions treatment, we protect them with cushioning or padding, cooling down by removing clothing and ensuring a fresh supply of cool air. When the convulsion stops, place them in the recovery position and monitor signs of life. If they become unresponsive, you must call for an ambulance. This usually affects children between the ages of 6 months and 6 years. The effects of heat and cold. Body temperature. How the body maintains internal temperature is generated in tissue by conversion of food, muscle activity, exercise, and shivering, and it absorbs from the sun, fire, hot food, and saves heat by constricting the blood vessels at the body surface and reduce sweating. The body loses heat. It may be lost to cool surrounding air, evaporation from the skin, cool objects in contact with skin, and it loses heat by sweating, an increased rate of breathing. The effects of heat and cold. Hypothermia. Body temperature falls to below 35 degrees Celsius. Heat exhaustion, caused by a loss of salts and water from the body through excess sweating. And heat stroke, a failure of the thermostat in the brain. Treatment for hypothermia. Remove the cavity to a shelter or warm place. Keep the cavity in a horizontal position. Insulate them from the ground and surroundings. Treat for shock. Cover with blankets. You call for an ambulance, monitor airway and breathing. Do not give them any food or drink. Do not rub the skin placed by a heat source, and do not stand them up or walk them around to get warm. Do not overheat, but warm them very slowly. The treatment for heat exhaustion. Place in a shade or cool environment. Remove outer or restricted clothing. Give plenty of water. Have 1 teaspoonful of salt to every litre of water. Lay them down, elevate the legs. Upon recovery, send to a doctor, and if the cavity deteriorates, dial 999 or 11, place them in the recovery position. Heat stroke recognition. Child complain of headache, confusion, general discomfort, hot, flushed, dry skin. Body temperature goes above 40 degrees Celsius, the brain will start to swell. Response levels deteriorate rapidly. There's rapid deterioration in general, a full bounding pulse, slow, noisy breathing. Treatment for heat stroke. Place in a shade or cool environment. Remove outer clothing, wrap in a cold, wet sheet, and be aware of the onset of shock. Dial 999 or 112 for an ambulance. Ensure adequate ventilation or a fan for the casualty and be prepared to resuscitate. Electric shock incidents. Electricity, high voltage. Electricity can be divided into 2 groups, high or low voltage. High voltage is carried through power lines and overhead high tension cables. Contact with them is invariably fatal. It's unlikely you can protect yourself from the supply, and it can arc or jump up to 18 meters from source. You must keep yourself away from the source, at least 18 meters, and you must call the emergency services. You must not attempt a form of rescue until it is safe to do so as instructed by the emergency services. As soon as it is safe, you must carry out your normal basic life support procedures. Low voltage electricity, the most common form of electrical injury sustained through domestic supply as used in the home or workplace. Can cause serious injury, even death. Young children are particularly at risk because of their curiosity and playful nature, and water will greatly increase the risk of electrocution. We break contact between electricity and your casualty. Where possible, switch off from the main supply. If you're unable to do this, you must insulate yourself before attempting to free the casualty. So you stand on a rubber-based mat and you use a wooden broom handle. Once your casualty is free from supply, you carry out your normal basic life support procedures. And be aware of potential serious burns to deal with. Burns and scalds. Many years ago, the Royal Infirmary in Glasgow gave us what we refer to nowadays as a Glasgow burn scale. This is used as best practice throughout the world. The full thickness burn will be the electrical burn. 2 layers of the skin, the epidermis and the dermis, are burnt through. There will always be 2 injuries, one where the electricity goes into the body and the other where it comes out. It requires hospital treatment. With the Glasgow burn scale, it also shows us the percentages of body. So the torso is 55%, head and shoulder, head and face 10%, and the area of the palm of your hand is 1% of your body. Partial thickness burns leads to rawness and blisters. If the burn is 1% or more of your body surface, then you must be sent to hospital, and 9% of people who are burnt will go into severe and immediate shock. Superficial burn, only the outermost layer of skin is affected, causing redness, swelling and tenderness. If this burn is 5% or more, then the person must go to hospital. So be very much aware if you fall asleep when you're sunbathing. Burns treatment. We flood each part with cold water for a minimum 10 minutes. Gently remove any jewelry or wristwatches that may be affected. Cover the area with sterile dressing. We do not break blisters. You do not apply adhesive dressings. You do not apply lotions, ointments or fats. And do not attempt to remove anything sticking to the burn. If you have a first aid kit and you have a burn shield dressing, you apply this after cooling the skin down, or failing that, the best thing to use is cling film. Poisoning. How poisons can enter our bodies. Ingestion, food, drink, medicines, drugs, corrosive chemicals. Instillation, harmful substances splashed into the eyes. Injection, bites and stings, needle stick injuries or drug abuse. Inhalation, toxic fumes and smoke. By absorption, chemicals and toxic vapors. Poisoned by household chemicals, bleach, oven cleaners, paint strips and detergents will cause redness, blistering and burns to the skin with swelling to the face and mouth if lips is swallowed. Distressed breathing, dizziness, unconsciousness. Poisoning general treatment. Identify the poison taken. Keep the casualty sitting up and give them sits of water to dilute the poison, but certain chemicals react with water when mixed. Always have an understanding of any chemical being used in your workplace and home. Do not induce vomiting. Keep the casualty still and call for an ambulance. And place the unconscious casualty in the recovery position and monitor breathing. If your casualty does vomit, try to catch some of the vomit in a plastic bag or sandwich bag, and when you go to hospital, take the bottle you found them drinking from and a sample of vomit with you to hospital. It will help the hospital identify the chemicals they're dealing with. Bites and stings. Human bites can be very painful and may cause considerable blood loss or infection. Animal bites, puncture wounds can carry infection deep inside the body. Insect bites and stings can be an irritation and are sometimes painful. There's also a risk of localized swelling and anaphylactic shock. Any bite or sting in the mouth or throat can lead to swelling and obstruction of the airway. Bites and stings treatment. Ensure safety and wear gloves. Keep the casualty still to limit the effects of any venom. Control any bleeding. Minimize the risk of infection by keeping the area covered and clean. Monitor airway and breathing. Call for an ambulance if necessary. Do not remove sting with tweezers, but try to brush them off with the edge of a piece of hard plastic. Jellyfish and sea anemones have sting cells that stick to the skin. These contain venom, and although relatively harmless in the UK, this venom can cause swelling and anaphylactic reactions. Brush the cells off with powdered chalk or pour vinegar over the affected area to neutralize the cells. Keep the casualty still to limit the effects of any venom, and apply a cold pack to reduce swelling. Monitor airway and breathing. And send to hospital or dial 999 or 112 if necessary. Sit the casualty down and immerse the foot or hand in bearable hot water. This helps to draw the venom back towards the injury site. Calm and reassure the casualty as they will be in considerable pain. Send to hospital or call for an ambulance. The spine should be removed in the hospital, and keep the injury area clean to minimise the risk of infection. Creatures such as weaverfish and sea urchins have spines containing venom as a defence against attack. These spines penetrate the skin and can be difficult to remove. Venom from these creatures can produce massive swelling. This can obstruct circulation, cause infection, and on occasions may cause paralysis and cardiac arrest. Snake bites in this country are rare and not usually fatal. These can cause varying reactions such as pain, swelling, vomiting, sweating, disturbed vision, weakness and breathing difficulties. Position the casualty on the floor in a seated position and keep them still. Clean the bite area. Bandage the injury tightly with a crepe bandage in order to reduce the circulation and the flow of venom. Immobilise the affected parts and keep it below the level of the heart. Calm, reassure your casualty. If the casualty becomes weak or unconscious, place them in the recovery position on the injured side. Monitor casualty's airway and breathing and be prepared to carry out basic life support. Call for an ambulance.